don't think you could look at it as forced trading or negotiation as much as what do you fight the hardest for? And I think, for us, it's about fighting the hardest to avoid the worst cuts, right? And it is about, to some extent, trade-offs, because if the alternative is cutting enrollment by work requirements as opposed to a more broad-based slashing of funding through per capita or the other really draconian methods of cutting federal funding just across the board. Sure, work requirements will have a less devastating impact, but they still don't make sense from a policy perspective, and they still will just result in loss of eligibility in a way that really doesn't make good policy, because the way work requirements have operated is that it's a major administrative hassle. It costs a lot of money on the administrative side, and people lose eligibility despite the fact that they might be working or otherwise qualify as exempt from the work requirements because of just the difficulty in reporting it and tracking it and so forth. So it turns out to be a way to, force people to not get the coverage that they need, even though they might very much be appropriately getting Medicaid coverage, despite they may be working, they may be seeking work, and yet they still lose their coverage. I think the studies that Kaiser Family Foundation in particular has shown with really good hard data is that when you look at who is the focus for the work requirements, the people that are actually so-called able-bodied, don't have caretaker responsibilities, aren't also in school, it's something like 92% are already working. But they're working in jobs that are too low paying, to be able to afford coverage on the market, and their employers are not paying them, aren't paying for health coverage. So those are the people that theoretically the work requirements are supposed to promote, self-reliance and work, but as a practical matter, they're already working.